Growing Up Weird.
Hi, and welcome to Growing Up Weird, the podcast where we explore how the earliest chapters of Western childhoods shape the health stories that we then carry into our adulthoods. I'm Dr. Greg Dickens, scientist and consultant in medical innovation, and I am here with Dr. Gwen Bradbury.
Hello.
Who is a healthcare researcher, author, and your guide through the science, stories, and traditional strategies that connect childhood beginnings to lifelong good health. Each week, we dig into the newest evidence, understand how it links together, and walk through some of the changes that we in the West could make to give kids decades of better health. So, whether you're a parent, a teacher, a healthcare professional, or simply curious about how the body and brain develop over time, you're in the right place. Are you ready? Have you got a cup of tea? Good. We begin, as ever, with the news. Gwen, any interesting news from you this week?
I've got a really good one. I'm really excited about this one.
Well, go straight in.
Okay, so this is a paper published in BMC Ophthalmology, and it says that secondhand smoke exposure is associated with an increased risk of developing myopia among non-myopic children in China, which is super interesting because we're learning more and more and more about what makes eyes develop myopia.
Yeah.
Roughly what happens is that the eyeball grows too long, so the eye doesn't focus light onto the back of the eyeball, sure. But what we are increasingly realising is that the area of the eyeball that elongates, that kind of elongates in an out of control way.
The equator.
The equator is driven by lack of oxygen in that area.
Oh,
you seeing where it's coming?
Yeah,
Yes, super cool.
That's
okay,
mad.
I'll hand over to you then, Greg. What do you think the link is between secondhand smoke exposure and myopia?
Okay, I can see two potential mechanisms here, and I will guess, and then I want to hear the evidence. Possibly, if you've got lots of secondhand smoke around, it might damage your lungs. Oh, no, it wouldn't. It would damage your blood. It would be more likely to produce methemoglobinemia, where your blood oxygen carrying molecule is damaged by carbon monoxide in the smoke, meaning less oxygen is available, meaning the blood vessels that are already struggling to get oxygen to that part of the eyeball have even less they can get there, worsening the oxygen deposition to that part of the sclera. The other option is that some of the chemicals in cigarette smoke are directly vascular toxic, and they will kill off small blood vessels, and it's the really tiny wee ones that we are, and I don't mean the ureters, I mean the little tiny blood vessels around the edge of the eye that we are most worried about. Which does the evidence support?
Great question, Greg. The paper actually doesn't say at all,
what
so I
surprise.
just really wanted you to give your perspectives on what was going on
You
here.
just wanted me to ramble.
No, I think those are the two ways that I also thought perhaps we were augmenting the effects of, focusing in low-level light, reading at night, lots and lots of close focus. We were augmenting how those strains affect blood flow in those areas of the eye, which leads to that dysregulated growth.
You say this was in China,
This was in China,
where
yeah.
those needs are massively tied into the culture.
Exactly. But I thought it was really, really interesting. And actually, I then went on a little burrow because I was like, I wonder what that says about vapes. And I couldn't find evidence about vapes and myopia.
Sure.
There are a couple of things I think going on. One, I don't know about the impact of secondhand vape smoke. Actually, that's kind of much less studied because it's such a new area. Everyone's focusing more on actual vaping.
I don't even know about the effects of first-hand vape.
Exactly. Exactly. And obviously, a lot of young people starts vaping after once their eyes are already formed to a certain extent. So they don't typically vape in that kind of really critical 6 to 12 year period. But also, actually, weirdly, nicotine seems to slow myopia progression or even delay it in animal models. So there's been interest looking at it, but given its addictive effects, it's not. It will never be recommended as a treatment in humans, but it seems to actually delay myopia. And that is because although the nicotine itself is a vasoconstrictor, it seems to act have effects through nitric oxide modulation, which can be either vasodilatory or vasoconstrictive.
Yeah, depending
on where you are. Exactly. But anyway, I just thought that was just a fascinating paper where I looked at the title and I was like, how could this possibly work? And then you go back to first principles and you're like, I can see a couple of different mechanisms around this actually. But I think what was cool about this paper though is that it's just another great reason that all of the smoking restrictions in the UK are as stringent as they are, because apparently 60% of children in some European countries are exposed to secondhand smoke routinely.
60%?
60%. The UK is a real outlier in Europe in terms of how much we've managed to reduce smoking.
Wow.
Which is a real public health success story.
That's pretty cool. Okay. Do you want to hear some revenge news?
Absolutely, revenge news. Go for it.
I mean, it's not so much revenge news as this is a returning volley. Okay. In 2021, the American Heart Association released their Simple 7 framework, wherein to have a healthy heart, you just needed to get 7 simple things right. There were 4 things you did. Oh no, 7.
I can remember 7 things all the time.
What a tiny number. Yeah, I kind of feel like 2. 2 is my number. 2 is the number of things I'd try and do to keep my heart healthy. But they said 7. They said that you wanted to do basically any sensible diet. Uh-huh. You wanted to have some level of activity, preferably lots. Don't smoke at all and get enough sleep. Those are 4 things.
Yeah.
All very sensible.
Yeah.
And then the other 3 were things that your doctor could tell you. Do you have a low enough level of blood glucose? Do you have a low enough level of blood pressure?
Okay.
And do you have a low enough level of body mass index?
Okay.
Or high enough, or whatever, within your safe bounds.
Yeah.
Safe / recommended / I mean, I've bounced along the underside of a beast my entire adult life, but whatever. These are the simple 7. So simple. Then Aguayo et al. Published 3 days ago in the Journal of the American Heart Association, basically said, these Simple 7, do they actually have any effect whatsoever? Does this align with real world outcomes?
Okay.
And so they studied, they meta-analysed 495 studies of, yeah, indeed. They were rigorous about it too.
Wow,
I was really impressed. I read through their methods section.
Okay.
The one that didn't impress me, just so you know, this isn't on my notes, my dear listener. This is just me mildly mocking the authors. They said when they couldn't agree on whether a trial should or shouldn't be included, its inclusion was based on, what did they say? Coherence with the views of the senior author.
Oh.
So basically, the senior author said, I want this one in.
Oh my goodness.
At least once or twice.
I mean, I guess when you've got 495, flagrant cherry picking is slightly less of a problem.
Indeed. But they found that in any one of these studies, kids getting those Simple 7 right numbered between 0% and 4% of the total cohort. And these were cohorts taken from all over the world. Yeah?
Okay.
0 to 4%. All over the developed world, I should say. These are mostly American studies, some from Europe, some from Japan.
Okay.
The other really, really interesting thing... let me just
confirm. So you're saying that fewer, either no children or less than 1 child in 25 was getting enough sleep, enough movement, good diet... not exposed to smoking, had normal blood pressure, normal blood glucose, and normal BMI.
Yes. Yeah.
Okay.
Although, again, I would fail this on 3-4 of their metrics. I don't smoke, but my BMI's outside normal range, my blood pressure's all over the place, and I don't get enough sleep. So, I'm not knocking these kids.
Yeah, no.
I'm just saying that our culture doesn't really set us up to
really doesn't, does it?
Meet these Simple 7.
God, poor kids.
But here's what happens if they do. The authors include a truly awesome figure as figure 1. And it says, where improved levels of these Simple 7 are statistically significantly correlated with... Here we go, you ready? Improved cognition and lower risk of dementia. Favourable cerebral volumes. Better whole brain volume. Lower risk of hearing loss. More functional teeth. Thinner carotid intermediate, basically better blood vessels. Lower risk of non-alcoholic fatty liver disease. Lower ALT. Lower gamma GT. Lower risk of hepatic steatosis. Better pregnancy outcomes. Lower risk of severe sleep disordered breathing and excessive daytime sleepiness. I'm not even halfway through. Bear with me, dear listener, and Gwen, don't cut me off just yet. Lower risk of all cancers that they looked at. Lower risk of metabolic syndrome, erectile dysfunction, multi-system, suboptimal health. Now, you will have noticed erectile dysfunction slipped in there. They were looking at these kids as adults. Wow. So, these kids were examined and then 10 years, 20 years later, rechecked.
Wow.
I'll finish the list. Better eye health, better heart health, obviously. Lower risk of lung cancer, chronic obstructive pulmonary disease, pneumonia, lower exhaled carbon monoxide, better adrenal gland responsivity, lower cortisol levels and stress, lower risk of obesity, lower risk of chronic kidney disease, lower risk of type 2 diabetes, higher muscle mass, lower visceral fat ratio, and lower risk of amputations.
Oh my goodness.
The American Heart Association's Simple 7 may not be very simple, but it does appear to be incredibly well correlated with all-cause mortality, all-cause morbidity.
Fascinating. The one I thought you were going to get onto, something about mental health there, but there wasn't. There was the cortisol piece, stress piece.
So the only links here to mental health are low risk of dementia, which is more of a neurological health thing, and better chance of better sleep.
Okay. Yeah, fascinating.
Yeah, they did not look at mental health as far as I can see.
Fascinating.
Anyway, as kids turning into adults and papers about the heart go, I thought that was really well put together and a big sample size, and they've done a grand job.
Fascinating. Thank you.
Well, there we go. Some news from both of us. What are we talking about in the main thrust of this podcast?
We're talking about hamstrings, Greg.
Ah, yes, of course. On the Waitrose centre aisle, next to other things I don't understand.
Like cheese strings.
We're not talking about cheese strings.
Oh,
Hamstrings.
the idea of hamstrings, that's absolutely nauseating. But thank you for sharing that.
For anybody who doesn't know, hamstrings are the large muscles that go from the bottom of your bottom to the back of your knee. They're the muscles that allow you to flex your knee, bringing your heel up towards your back. Mm-hmm. There you go. Just thought I'd translate. Why are we talking about hamstrings?
We're talking about hamstrings because they are, I'd say that of our muscle groups generally, in our culture, they're probably the muscle group that has the hardest time. And so we see the problems with them. And people, I think we kind of are familiar with hamstrings as a concept in a way that actually we're not very familiar with many of our muscles to the same extent as our hamstrings.
I did not know the word hamstring until I got to vet school.
What? Really?
I knew the word hamstrung.
Hamstrung. Oh,
I
great.
I knew the idea of
good.
being hamstrung, but I didn't understand what the heck that came from.
Oh, fine. Well, okay. Well, I'm sorry to...
This is why I translated it.
Yeah, thank
just
you very much.
Just for the one listener out there who's like me.
Well, I just feel like in the exercise world, everyone's talking about hamstrings. And in the...
Which of your two authors comes from the exercise world? An exercise for the listener.
I guess, doing competitive sport as a late teenager, I guess hamstrings were quite a preoccupation. So I just assumed this was, part of common knowledge. So apologies for pitching this at the wrong level. But I wanted to talk about hamstrings for two reasons. One, because, the first big reason was that when we were away, when we were in travelling across Africa, Greg, what did we notice about people's hamstrings?
They were incredibly either long or stretchy.
Yeah.
They certainly allowed people to stand straight-legged and work at floor level.
Yeah.
At the same time. Not two separate events. We're talking about people who could happily sweep the floor, walking around with straight legs, using a 6-inch brush.
Yeah.
Or
do the laundry.
Could do the laundry in a bowl on the floor.
Yeah.
Or could pick fruit growing from strawberry bushes while walking around with straight legs.
Yeah.
It was awesome.
Mow the lawn with a machete.
Mow the lawn with a machete and not a big one, like a foot long.
Yeah, just amazing. But I think it was something that really, it made it very clear how different people's leg anatomy is in different cultures and how dependent that is on the early childhood period. Because as any of us who've tried to elongate their hamstrings will know, and I know you're one of them, Greg, despite only learning about this in vet school, it's incredibly difficult to get much difference in your hamstrings. You can get a bit, absolutely, but there's no way that either of us could be mowing the lawn with a machete right now.
Or ever.
Yeah, exactly. So I was kind of curious, why is it that there is so much difference in hamstring length between people in different cultures? And it comes down, I think, to... Oh, sorry.
Before we go down to what's causing it, who cares? I mean, I've got a scythe. I don't need to cut the grass with a 1 foot machete. Similarly, I've got a broom with a long handle. Why do I need longer hamstrings?
You want longer hamstrings because, well, you need to have hamstrings that are the right length because it enables your lower back to be in the right position, which means that you have less stress on your lower back, less likelihood of getting back pain. Similarly, you want your hamstrings to be the right length so they're letting your knee work properly and you're not putting a lot of load through bits of cartilage that are too thin to be coping with them all the time. And you want to have hamstrings that can stretch and recoil so you're less likely to tear or injure them when you're doing other things.
Perfect. I'm sorry to have delayed you. What were you saying about what might be driving it?
So I think there are two things going on with why our hamstrings really struggle. One is that there are things that we do that make them too short.
Sure.
And two, there are things that we do that make them not very stretchy.
Okay, start at the top then. How have I made mine too short?
So one of the things I don't think I'd learned at vet school, though maybe you'll correct me, is that muscles... I understand when you kind of work a muscle that it gets bigger, it gets stronger, right? But what I hadn't realised is that the position that you typically hold a muscle in determines how long or short it becomes.
Sarcomere addition or subtraction.
Exactly. And it kind of makes sense, doesn't it? Because if you're always going to hold your muscle in a position where it's kind of loose and floppy, it's not going to be able to work very effectively. So what your body wants to do is shorten it. So if it's always going to be working over that kind of what we call a range of motion, then it can work as effectively as possible, right?
Can I chuck in a little muscle microanatomy for our listeners here? Your muscles are, as you probably know if you've ever eaten meat or really, really poked yourself in the bicep, are made of long strings. Those fibres and fibrils are divided down finer and finer until you're dealing with very, very, very thin threads, like many would fit inside a human hair. But those themselves are not just long, smooth, thin, nylon-like strands. They're stripy. They are made of individual units called sarcomeres. These sarcomeres are where the actin and myosin threads, if you want to get technical about it, overlap. And the way a muscle shortens to do its job is by increasing this overlap. If you imagine, two trains passing on two tracks, they're parked about, half overlapping. And by increasing that overlap, they shorten the distance from the far ends. By decreasing the overlap, they would increase the distance between the far ends. And that's just what these two strings do. They are most powerful. Muscles are at their fastest, twitchiest, best selves when those strings are half overlapped. If you leave your muscle, if it's too long for the space in between the two bones it's trying to pull together, then the trains are naturally going to increase the level of overlap, which takes you out of that perfect, twitchy, efficient, powerful phase. You have too many trains, in effect. So what the muscle does is whip out some of them trains and until it's filling the gap perfectly between the two bones, and all of the actin and myosin filaments are at half overlap. Similarly, if your bones have grown because you're a painful teenager, I'm sure not everybody had growing pains, but I'm 6'5" and I really did have growing pains. Anyway, your bones grow, your muscles suddenly find that the same number of trains are now almost not overlapping at all to fill the gap between the two bones. So what does it do? Adds more trains until we're all back to half overlapped. There we go. That's serial sarcomere addition, technical term for add more trains.
Yeah, I love it. Love the train metaphor. Fantastic.
Came up with it on the fly. It's a little ropey. I do my best.
So yeah, exactly. And I guess, the key point of what you said there is that if your bones are the kind of the number of trains you have is dependent on how you hold your bones.
Sure.
So if you often hold your bones in a certain restricted position, your muscle will get shorter.
Yep.
Similarly, if you're always holding them in a very stretched position, they get longer. But what this means for your hamstrings in particular, as Greg said, they run between your bottom and just past your knee.
Yep.
If you are always holding them, so they are quite sort of crunched up, there are too many trains, then they get shorter. And what do we do that typically keeps our hamstrings quite
Let's see, what
close
sort
together?
of position might lead to that? You're talking about flexing the knee and bringing the bottom closer to that. Sitting would do that. Incredible.
Absolutely. It's our old friend chairs. Yeah, absolutely. When we sit on chairs where we've got, a nice kind of tucked under pelvis and we've got our knees at 90 degrees, we are really shortening the distance over which our hamstrings have to work. And what this means is that our bodies end up taking away some of those trains. So we have a hamstring that is okay at dealing when we're sitting, but actually is too short for what we need it to do when we're standing. But that's just one of the pieces, Greg.
Yeah, so that would give you hamstrings that were too short. Mm-hmm. But you said they weren't stretchy anymore. Mm-hmm. And I think I agree. My hamstrings were too short. Mm-hmm. I noticed that I couldn't touch my toes very well. But it wasn't just that. No matter how much I tried to train them, mm-hmm. I didn't get anywhere near. Mm-hmm. What's going on there?
So that is the other thing that sitting does to our hamstrings, which is it squashes them for often pretty long periods. We've talked before about how soft surfaces reduce our ability to feel when we're doing damage because they distribute the pressure over a large area, which means that our normal sensors for detecting when we're uncomfortable don't notice, but you still get enough pressure to reduce the blood supply to parts of our muscle. Mm-hmm. And what that means is you end up with parts of your muscle that are working and trying to survive without being able to get enough oxygen and nutrients. And some of the time for a lot of the time, they manage by switching into a sort of survival pathway. It means there's more inflammation, but it does mean that they can at least run on a lower level of oxygen. But that only takes you so far. And a small proportion each time you do it, but a proportion of those cells can get starved of oxygen so much that they die. What happens when cells die in a tissue like that?
In a tissue like that specifically, is they tend to be replaced with fibrous scar tissue. Mm-hmm. If it's a big enough thing, you will see it and say, that's a scar. Mm-hmm. If it's a much smaller collection of a dead cell here and a dead cell there and a bit of fibrin that turns into collagen there, I guess you just end up with something quite stiff.
Yeah, you end up with a muscle that doesn't look too bad, but it doesn't have nearly the amount of stretch that a healthy muscle should.
And I guess, actually now I think about it, the fact that muscles are all long strings, if you put random crosslinks in between those strings, there is no structure better suited to becoming stiff with a small number of scars.
I had not thought of that.
I mean, if it was anisotropic, if it was just a mash of things going in different directions, random scarring wouldn't stiffen it up anywhere near as badly. But because they're all going in the same direction, yeah, that's interesting. I hadn't considered that.
Yeah. So fundamentally, there are various things we do to our hamstrings which make them more, in childhood, which make them more likely to be short and to be stiff in adulthood. And this has knock-on effects for back health, for knee health, for injury risk.
Interesting. Okay, well, I can completely understand now that the people we were seeing in East Africa, West Africa, even in South America, amazing hamstrings all over the place. probably weren't sitting as much. And if they were, they probably weren't sitting on chairs that would do them quite so much damage. What can we change around here that will help kids to grow up into adults who have longer, stretchier hamstrings so they don't knacker their knees or lower backs?
Great. So I think there are probably 4 areas I'd look at. Okay. First, we've talked about shoes many times before. So if, having heels on your shoes also alters the loads up and down your leg, which shorten your hamstrings.
No way.
Yep. So shoes appear to be a big contributor.
Okay.
Chairs, obviously, I should have started with that one, but yes, keep kids out of chairs as much as possible. Get them sitting on the floor.
2 reasons though here, right?
Yep.
We're dealing with getting rid of that 90-degree leg bend and getting rid of force going up through the hamstrings when it should be going through the feet and the...
And should be going through the bones of the bottom. Yeah.
So sitting on something like a small wooden stool would be less troubling. Yeah,
small wooden stool, floor if possible, because then you get the increased, you have to work to go up and go down.
Okay.
But if failing that, a harder surface to sit on is better.
I assume they should be eating gruel at the same time.
Absolutely. We're all about absolutely punishing children here.
Okay. It was just the small wooden stool image just made me think, oh, the poor urchins. Okay, got it. Just no big plush thrones and beanbags.
Absolutely, yeah.
Fine, okay. What else we got?
3, get them walking a lot, because walking in non-heeled shoes helps the leg extend far back, and it helps to stretch those hamstrings, and it keeps putting them in a position that leads to better lengthening of that hamstring.
Far forward.
Yes, or yes. Wait. Yes, far forward, not far back.
Far back, I assume that's hip flexor.
Yeah, you're right. Far forward. Good.
So I assume
good. No, I'm
that if you're also going far back, you're probably going far forward as well, right?
It's true. Yep. And the 3rd one I was going to call out was squatting.
Yeah, good shit.
Squatting, again, is a great way of stretching all of the muscles around your kind of buttocks, etc. Yeah. Hamstrings are one of those.
To be clear to anybody who spends any time on the internet, we are not talking about the meme-friendly Slavic squat. We're talking more about the small child bending down to investigate a ladybird squat, where your knees end up by your ears, and your heels normally are on the floor.
Yeah.
Very difficult to do in inflexible shoes. Very, very difficult to do in heels. But very good for your lower back, hamstrings, etc.
Exactly.
And, you look cool doing it.
Yeah.
That's what I've been telling myself.
I did actually once see this woman at a baby group squatting in the most beautiful squat. And I went over and I was like, I don't know how you've got your heels on the floor, but I'm so impressed. She looked really pleased. She was like, yeah, I've always done it since I was a kid. And I was just like, so envious.
Things that giant men can't say to women at baby groups. Cool. Okay, that's useful. Anything else we need to know?
No, I think that's it.
That is useful. Hamstrings. I hadn't really thought about how useful they were and how to look after them. We've done some news. We've done a main article. Listener question?
We do have a listener question.
Oh, cool. What is it?
So the listener question is about last week's article, which was on how clean should children be.
Sure.
And the listener asked, I'm curious about how swimming comes into play in the discussion around skin barriers and washing. Obviously, chlorinated pools have got their own considerations, but what about freshwater swimming, rivers, lakes, etc.? Does daily summer dipping have the same effect on the skin barrier as bathing?
Well, hang on. We did mention that. Bathing with or without soap damages the barrier.
We did, yes.
So I'm gonna guess it's probably not very good for you.
Yeah, but fascinatingly, there's a big difference depending on the temperature of the water. So yes, cool, right? So spending a very long time in water, yes, the skin gets waterlogged. The skin barrier can't cope. We are not a fully aquatic species. We just don't have
the
that.
aquatic ape hypothesis.
Well, I mean, the aquatic ape was a kind of semi-aquatic ape, wasn't it? It wasn't completely aquatic. It was just quite wet. Oh yes,
the soggy ape.
Soggy ape hypothesis. Yeah, absolutely. But what's really cool is that there are various papers looking at the difference on the skin barrier function between when it's exposed to hot water and cold water.
Sure.
Exposure to both, but to I can't say all temperatures, but both temperatures of water does worsen the skin barrier, but to very different extents. So exposure to hot water, I think that's about 44 degrees, increased the leaking of skin. That's what we measure as a kind of proxy of...
To be clear, nobody's washing their baby at 44 degrees.
That's true.
That's hot.
Yeah, absolutely. But I'm just showing, we've just got two different levels. But so if you expose skin to around 44 degrees of water, you get increased leaking by about 130%.
Okay.
So more than doubles.
Yeah.
But if you expose the skin to colder temperatures, you increase leaking by about 20%.
Oh, wow. That's a
it's a really big difference.
As I guess, I mean, we're dealing with a barrier here, which is protein plates covered in wax and oil.
Mm-hmm.
Yeah. I think anybody who's washed plates, greasy plates after a meal, and has done it in cold water and has done it in hot water, will say, yeah, those numbers stack up.
Yeah.
Much like plates. Sorry.
Very good. But I think it's really interesting because actually the paper that I was reading says, maybe we should be recommending that people wash their hands with cold water or lukewarm water, not with hot water, especially if they've got any inflammatory skin diseases. That's clearly something we think about a lot as veterinary surgeons when you're always scrubbing your hands. But so they were thinking about it from a hot water perspective, from a hand washing perspective. But clearly there's an obvious overlap with whether or not you are dipping your freshwater swimming, etc., in water bodies which tend to be much, much colder than your typical bath.
Yeah, that's really interesting. I cannot believe I hadn't thought of something that simple.
Yeah, it's cool, right?
Yeah, that's cool. Article, news, listener question. We have stuck to the recipe. Folks, thank you very much for listening to me, Dr. Greg Dickens.
And me, Dr. Gwen Bradbury.
Catch you next time. Bye.
Bye.